I don't know why pitfalls being removed from the portion of the symposium. Anyway, there are pitfalls. When we're talking about vestibular laboratory testing, there are pitfalls I'll show you. First of all, video هيد باس تيست دكتور فراس يعني كفى ووفقه يعني راح نتجاوز على نورمال هيد باس تيست يشوفون هاي الموفمنت جايه كل السيم سيركل تناسبيه الهيد موفمنتس والجيمز كلها كل السكس سيم سيركل نورمال سو اتس نورمال. هنا هذا اب نورمال نشوفه بالليفت سايد نشوف واضح انه اكو اوفر سيكاز كل الليفت سيم سيركل كناز سو ات از توتال رايتس اوف ذا ليفت سايد. البنفيت هنا نشوفه هنا البليك نقدر نحصل السكاز بس مثل ما قال الدكتور فراس we can see only the overt sectors. We can with the video impulse test we can identify the covered sectors which would be usually from 100 to 200 milliseconds which cannot be seen clinically at all. Also we can have a gain of the vestibular reflex. So this is a success. Clinical impulse test can detect all these extra things. So this is a success of vestibular testing. Video nystagmography is a record of the abnormal eye movement, which is nystagmus, and also it is a report of the spontaneous positioning, valsalva, during valsalva, with head shaking, with hyperventilation, caloric, rotatory chair. Also reports smooth pursuit, saccades, optikinetic movements, all of these. So this is example of spontaneous nystagmus. As you can see, the eye is covered. There is a right nystagmus, and if you can see this red light, it means that the operator is just open up a light inside the goggle. So it is induced gaze here. So the nystagmus is diminished. So this is a confirmation that this nystagmus is peripheral rather than central one, because as you know, if it is gaze-evoked nystagmus, this is central. But now the nystagmus is disappeared because the patient starts looking to light, so this is peripheral nystagmus. And you can see for the VNG, we can have maximum slow phase velocity, mean slow phase velocity, frequency, number of nystagmus in 1 minute, and everything. This is the saccades. Saccades eye movement examination by VNG can detect details of abnormalities like hypermetric and hypermetric abnormalities in central pathologies, and this is again a success of vestibular lab testing over clinical saccadic eye movement examination. This is smooth pursuit. As you can see, it is a saccadic, also it is a sign of central. This is caloric test. Who's from the specialist? Is it obsolete test? Who of the specialists here till now doing caloric test? Dr. Mohammed, do you perform caloric test? No. Dr. Firas? Very infrequent. So for me, I started doing caloric test because why? It is still there, but in my presentation, there is a role for Dr. Firas the presentation. There is a role for caloric test. Rotatory chair is also a test for vestibular testing, but it is in the mid frequencies. So we have just Dr. Firas also mentioned caloric very low frequency, rotatory chair mid frequency, and head impulse video head impulse test is very high frequency. So that's the point. It is a pitfall. It is a pitfall. It depends on one test to confirm non-presence of vestibular hyperfunction. Now, if your art of history taking and physical examination show that there is vestibular hyperfunction and you get head impulse test negative, you should proceed to other tests to confirm the presence of vestibular hyperfunction in other frequency, because probably the head impulse test is negative but the caloric would be positive. So there is a role for the caloric in very infrequent cases. So, sorry?
What the superior of the calorics on the video head impulse at which disease?
it is vestibular hypofunction because you don't know at which frequency your patient have vestibular hypofunction. So probably if you don't get hypofunction by head impulse test, you can get it, for example, by rotatory wheelchair also. If you don't get it with rotatory, you can proceed with also caloric because you can get, for example, ratio difference between the gain of VR. It is also mandatory. It's also needed in that scenario only. For vestibular evoked myogenic potential دكتور محمد غطى وفوق قلنا اكو سي فامس واوفمس وساكول ويوتريكال عندنا بس 10 دقائق. هذا example of ovum and of C vam, and you can see there is a ratio difference also دكتور محمد غطاها خلينا نمشي عليها بسرعة. This is ovums. This is, you can see there is a wave on the right side and there is no wave on the left side. This is also significant that there is superior vestibular nerve problem on the left side. And this is frequency tuning in case of lymphatic high growth, but we should keep in our mind that aging also can produce frequency tuning to our higher frequencies. So this is also successful in case of renal disease because it is highly sensitive for endolymphatic hydrops. This test is very sensitive to endolymphatic hydrops. And in case this is in case of superior canal dehiscence, paired window pathology, you can identify the waves in lower intensity level because usually, as Dr. Muhammad says, that VEMPs is usually at very high intensity, like around 9 to 100 decibel. If you can get it at, for example, at 65 or at 60 decibel, this is diagnostic of superior canal dehiscence. So in case of your art of history taking and physical examination suggests superior canal dehiscence, it is a pitfall to do VEMPs of high intensity level only. You need to decrease the intensity level of your device. So there is a pitfall. Now, electrocochleography. As you know, it is a recording of SP/AP potential, and there is intratympanic, invasive, extratympanic, non-invasive. Nowadays, we don't recommend to go for invasive procedure. You can have extratympanic, what is called gold fold tips over the surface of the tympanic membrane. And in this case, when the ratio is more than 0.5, it is highly suggestive of endolymphatic hydrops. And this is examples of one of my patients of Meniere's disease. Now, this is again, there is, as I mentioned in the first presentation, common is common. We know the 80% of cases, but again, there is a rare cases. Now, what is the importance of vestibular lab testing? Is to confirm or is to confirm diagnosis of rare cases, not the common cases. Now, if isolated circular dysfunction, a rare disease where you can get vHIT will be normal, VNG normal, positioning test is negative, VEMPs normal, but CVEMPs is absent. So it is a pitfall if you do only if you don't have VEMP study in your setup for diagnosis of this disease.
Dr. Haider, please, 2 minutes left.
So if we are talking about vestibular lab testing, you need to have full pattern. If you depends on few tests, definitely you will have a pitfall. Take home messages. It is less than 10 minutes. History taking and physical examination remain the cornerstone of vestibular assessment. Laboratory testing result should be identical with physical examination. يعني أعطيكم مثال. هسه كنتم otolaryngologist مع حسن تقديرنا الأخ الدكتور النيورولوجيست. عندك مريض سويت له أنت بالعيادة otolaryngologist سويت له بالعيادة تونينج فورك تيست. طلع البون higher than. دزيت البيورتون طلع لك no airborne gap. تقبل هذا البيورتون لما تقبله. What's that? This is something wrong. There is something wrong. No, it's the same. It's the same with vestibular testing, with vestibular lab testing. If you are fully confident of yourself, if you are fully confident with what you have with the history with your history and your art of physical examination, and you get something, you should correlate with what you get with the vestibular lab testing. So it should be identical. All tests are required depending on one test, usually misleading to the diagnosis. A doctor doing lab testing needs to have a good background of clinical experience, otherwise the result would be catastrophic. Reports suggest diagnosis is very important after doing the test. The goal of doing the test is reaching the diagnosis rather than doing the test itself.
I respect what results from حقيقة from Sulaimani. For example, some critical cases they can suggest even more than one diagnosis. So take home message: if you do your vestibular lab testing and for a difficult case and you don't get, I'm not sure the diagnosis is better not to write a report rather than to write a report which will have some pitfalls. Thank you very much.
شكرا جزيلا.